Here today. As you all know, back in July 2021, the city of Reading was awarded a $3.9 million grant funded by the U.S. Department of Health and Human Services and their Offices of Minority Health. The intent of the funding was to alleviate the health burden of COVID-19, its underserved communities, and the effect they would have. Our partners, sub-awardees under the grant have been Reading Area Community College, Penn State College of Medicine, and Latino Connection. For all of their hard work and expertise, we say thank you from the bottom of our heart. With this grant, the city sought to build partnerships to work, understand and support health literacy with health servicing organizations here in Reading. Through the partnerships established, policies, procedures, and practices were assessed with each organization. Those esteemed organizations include, and I am so honored that we have had the ability to build these relationships, Berks Community Health Center, Berks Counseling Center, Faith Care, Penn State Health, St. Joseph Medical Center, Reading Community Pharmacy, and Reading Hospital Tower Health. Each organization completed an organization health literacy assessment, and recommendations were made to help build organization health literacy, implementing various projects and services to our community. We are here today to award each of them grants in the amount of $20,000 to implement the recommended changes. And I know this is just a little something for the great work that you guys will be doing. As I wrap up, allow me to extend a huge thank you to our organization partners for your dedicated efforts in providing our community members with healthcare experience that is health literate and equitable. Folks, I can't say that again. I can't say that enough. You know, as somebody that has worked in the field of health coverage for 17 years. A lot of people don't know that I'm a federally licensed health insurance agent. So even before COVID, I saw the need that our community had or was facing when it came to health. So to educate them and to protect them, I am truly grateful. Thank you. A hand to you guys. The changes you're implementing will make a material difference in the lives and quality of life for all our residents. These changes will help remove barriers in accessing healthcare, and for that, we are grateful and happy to extend our financial support. As I stated a few minutes ago, I know this is just a little lending hand for all the work that you guys will do. In fact, yesterday, I was able to pick up the phone and call Ms. Mary from Community Health because I personally, a family member, needed a COVID test, home test. And this is still a reality. This is still much alive. So your services is much appreciated. And I thank Ms. Carbo that within minutes I was able to pick up at-home self-kit. Testing kit. So, you know, I cannot say it enough. Thank you for your commitment. Thank you for your willingness to educate. Thank you for making a difference in our community. May God bless you all. And let's keep the great work that you guys are all doing in our community. Please stick around so that we can have a photo with those that I mentioned a few minutes ago. Thank you. And you know, I would be remiss if I don't thank the staff. You know, I'm sorry, my apologies. to Dr. Brookings and all the dedicated staff that have committed the last 3 years to making sure that this grant was utilized in an appropriate manner. I say thank you.
Thank you, Mayor. Thank you for your leadership as we're working on this initiative. At this time, each organization will have up to 5 minutes to just speak about your project. And we'll start with Berks Community Health Center.
Glad we were able to help. Good morning. My name is Debbie Hartranft. I'm the Chief Community Relations Officer at Berks Community Health Center. We're very thankful and grateful for this grant. It really provided us an opportunity to implement 3 projects. Just quickly, a little bit about us. We're a federally qualified health center. We are here to provide health care to the underserved in Berks County. In 2023, we served over 19,000 unique patients. 81.8% of our patients are Hispanic, and 92.8% of our patients live under 200% of the federal poverty level. So with the funds, we implemented 3 projects. The first was multicultural care training facilitated by one of our CRNPs, Certified Registered Nurse Practitioners, Demas Cortez. This presentation provided tools and resources needed to improve our staff's communication skills with patients who have limited English proficiency. It focused on reaching multicultural communities to properly diagnose, manage, treat various health conditions, and provide the ability for everyone to attain health equity. This training was provided to all 170 employees of BCHC, and I have a few comments that were stated in the post-assessment from some of our employees, and they were, my main takeaway was the sensitivity that is needed for those just coming into the country who do not understand the U.S. healthcare environment. Another comment was cultural differences can make or break someone with chronic health conditions. Be sensitive to culture. And the last one is walking out with a patient after the appointment is important to maintain a connection and develop a relationship. So these are just some of the takeaways that our employees had due to this training. The second project we implemented was a diabetic education program for patients who were either newly diagnosed with diabetes or have a past diagnosis but really don't understand their disease and aren't able to treat it properly. So our registered dietitian, who is also a certified diabetic educator, developed a 3-week program. We've tried longer programs in the past, they were not successful, so she condensed it into a 3-week program to educate the patients. And our providers referred patients to the program. We were hoping to have 10 in each cohort. Unfortunately, we did not reach that, so we are assessing what barriers there were for those patients that were referred to the program. Why didn't they attend the program? But week 1's education explained what diabetes was, what the numbers mean, how the medications work, and why to check your blood sugar. Week 2 talked about diet and lifestyle changes, including carb counting, portions, balanced meals, and recommendations for activity. And week 3 did some troubleshooting and the ABCs of diabetes, A1C, blood pressure, and cholesterol. The cohort started in December. We had one in December, one in January, and unfortunately our diabetic educator resigned recently, but Kelly was very quick to refer me to somebody very highly qualified, and we will be continuing it into February. And the last project is providing us an opportunity to take the after-visit summaries that we provide to our patients after their appointment that are currently all in English and translate them into Spanish. So our providers are currently identifying the most widely used instructions, and then the city is helping us have them translated, and then our IT department will be uploading them into our electronic health programs. So this is really a first step in having a lot of our instructions and materials translated into Spanish. So we're very grateful and thankful, and I'm sure our patients thank you as well.
We will continue with Berks Counseling Center, followed by Faith Care.
Good morning, everyone. I'm Chris Axford. I'm the CEO for Berks Counseling Center. And I'd like to thank the mayor and the city for this funding opportunity, as well as the committee that worked with us. Berks Counseling Center has been around for a very long time, and we pride ourselves on the way that we provide healthcare. And we thought we were doing fairly well in terms of health literacy, and I can tell you we learned a lot, and we have a lot of work to do yet, so we're very grateful for this opportunity. If you don't know as well, we're a certified community behavioral health clinic. We serve 3,000 persons each year with mental illness, substance abuse, many homeless, many from the criminal justice system. So very vulnerable, needy populations, and providing care and health information in ways that people can understand and be engaged in their health care is both challenging and critical. So we kind of had a two-pronged effort, and the first is really just overall to improve our communication and our information for people to better understand the care they're receiving. We also serve a largely Hispanic population. We serve a largely Medicaid population. And we know in many cases we need to provide this information in a way that's meaningful to them. We also want to engage them in healthcare, which is very critical to us. So the second part of our project, which we're super excited about and has just begun, is implementing a health portal as part of our behavioral health record. Our patients have an EHR, just like we all maybe have a medical record that we can access and go into a portal. But up until now, they haven't had that level of engagement in healthcare where they have that ease of access to that information. So we're very excited to be adding that, and we're just beginning that process of working with the company that's helping us to do that. So thank you very much for helping us to better serve vulnerable populations in the city. Thank you.
Thank you so much. My name is Peter Schnatz. I have the privilege of representing two of the recipients today. I'm an employee, an educator, a physician at the Tower Health Reading Hospital, but I'm speaking here today, Anne Marie, who's the clinic manager, and I, as the CEO and chairman of the board of Faith Care, I'm speaking today on behalf of Faith Care. Faith Care, the mission of Faith Care is to bring health, hope, and healing. And this is our 30th year as an organization. We've been serving needy people around the world who aren't able to get health care, but also are burdened with a lack of hope. One of our goals as an organization is to not only bring that kind of health care, because people need to be met where they are with the needs that they have, but also in a holistic approach that's meeting not just their physical needs, but their mental, their emotional, their spiritual needs. And our goal is to not only do that internationally, but around the world. And right here we have a clinic in downtown Reading, which the exciting part, and obviously being a part of Tower Health, which we do wonderful, incredible things, is that through the clinic we're able to fill some of those gaps and holes where patients slip through, patients that even here living close to the hospital aren't getting health care, whether it be for financial reasons, whether it be for immigration reasons, whether it be for health literacy reasons, for a variety of reasons. One of our goals as an organization is to help not only do this, but to train up the next generation of healthcare providers to be able to do this for years to come, to be able to meet the physical, mental, emotional, spiritual needs. And to do that, bringing care to the needy. A fellowship program where residents and students and nurses can learn how to bring care to the needy in international and inner city communities. And to do that, we need a place internationally, but also a place locally. And so we're opening a hospital in a rural African village in 3 weeks, which is very exciting. And we have our inner city faith care PA Wellness Center. This grant will be able to really help in many ways. Several things I'll mention. At the root of all of it is health literacy, because we know how incredibly important that is. I can go into a room and tell a patient your BUN did this and your creatinine went to here and your LFT's this and that, and I can feel really good about myself, but they have no clue what I've just said. And that's just scratching the surface when we get into language barriers and all kinds of things. And so this is an area I'm passionate about. So each of these areas that we're talking about, at the root of it is health literacy. We're going to be working on our policies, but also our ability to communicate not only to our team, our volunteers, and our patients, but the community, who we are in a better way, because many of you may not even know that we existed. We're like a Doctors Without Borders. Now, if I said that, everyone's like, oh yeah, I know Doctors Without Borders. Do you know where their headquarters is? Do you know anything about them? No, but you know they exist. But here we are, Doctors Without Borders, right here in our community, and we didn't even know about it. So we want to do a better job of communicating who we are, because we're Doctors Without Borders on steroids. We don't only do the physical, we bring the mental, the emotional, the spiritual. So we're going to do a better job of communicating who we are, what we're doing, and to do that in a way that our staff and our volunteers can really have an appreciation for that, improving information on the website and access through the website. We're also going to have a much enhanced orientation process, so that as our volunteers come on board, there's going to be a video that they watch. They'll go through, click through a PowerPoint, and then have a formal process where they'll meet with one of the team members that they're signing up to for a tour and a shadowing session, and really help to get them prepared in a better way to meet those needs of our patients. We're also going to be working greatly on our translation services, and recruiting additional translators and helping educate them. And obviously part of that, not just with the translators, but with our staff in general and our patients, is education specifically related to health literacy and improving the ability to communicate and allow the patients to be able to verbalize and speak back what they've heard and that they've truly understood. So we appreciate this grant so much. We thank you for all that you're doing to help improve the health of the inner city. Thank you.
I'd like to acknowledge Monica from Penn State Health St. Joseph Medical Center here in the downtown area. She was not able to make it today, but I wanted to acknowledge her. And we'll finish up with Reading Community Pharmacy, followed by Reading Hospital Tower Health.
Good morning, everybody. My name is Ken Patel, and I'm from Reading Community Pharmacy. We are working, I'm really excited to be a part of this program, and we're working in different parts. First part, we're creating a simple, easy to understand material for like a day-to-day people, like the every day, so they can understand this material in a simple language. We're creating this material in both bilingual, like Spanish and English. The second part is a social media presence, because a lot of people nowadays use social media, so we want to create the website which has the same material, but shorter version, like the people who doesn't have time to read the whole thing, so we want to make sure that they get to the point, understands the material. The third part that we're working together is education of the staff, so that's also important. So we educating the staff, giving them a proper training so they can provide better training, better education to the people. So, and I'm very thankful to the City of Reading to giving me the opportunity to be a part of this organization. Thank you.
Hospital. In my regular job, I'm Vice President of Nursing Clinical Practice Education in our Center for Patient Safety, and I'm currently in the interim CNO role, so sort of seeing and doing a lot of things. And I want to say, somebody had said about staff transition. Our system director of patient education at the time was working with the city and working with our community wellness to do the assessment. And then we had transition, and she retired. However, we knew by our assessment we had opportunities around our policy, opportunity around our staff development around this. And I am very, very grateful to Paige and the team because they reached out and they really helped us to recognize how we could utilize this grant to better serve our patients and make the things that we found in our assessment really come to life with actionable items. So some of the things that we are doing currently, and we just sort of got started, and I'm really excited with one of the things because I think by building the bench strength of our staff around health literacy, we are serving our patients so much better, and we're really enhancing our ability. So one thing that we have completed, we're in the process of completing is we are looking at how we communicate, how we provide closed loop communication, how we make sure people understand and truly recognize what we're doing. And we're doing that through our Team Steps program, but what this grant is supporting us for is to have the quick reference guides. So it's not you attend a class, but you have something that lives on, and we have that reminder. The second thing that we just kicked off is a health literacy certification for a team of our staff. And we recognized that that was a gap for us when our system director of education retired, and it's like, who's our go-to? And so I have a team of 5 that will get certified in health literacy. And it's a really quite extensive program. And by doing that, we have that, it's not just one person, but we have a team. And we have a team that can support our teams and our patients. One of the other things we looked at was not only staff education, but also patient access, patient knowledge on what to ask, when to ask, how can I ask this. So we're looking at implementing the IHI Ask Me 3. So a lot of really positive stuff, and I'm very grateful for the city for this grant. I'm grateful for the team for really sticking with us and saying, here's some great ideas, and really looking at how we can better serve our patients by giving our staff the knowledge they need to do it right. So thank you.
Thank you again. As we come to a close, I want to acknowledge my team, my Advancing Health Literacy team, starting with Caitlin Kammerer, she's the project director for the city of Reading, Kelly Kidd, she's also the project director coming from RAC, and Andrea Murray, she's working with our biostatistician from Penn State College of Medicine. And I also want to include one more, Enid Narvaez. She works with us very heavily in the beginning, but has now transitioned to another role, but I want to acknowledge her work with us. Thank you again for attending today, and have a great day. We will conclude with having our pictures with each organization. Thank you and have a great day.